All right, so welcome and thank you for joining us today. And we're honored to introduce you to several incredible therapy teams that I have today. And so I have several therapy teams on stage with me, and they are part of some very meaningful pet therapy. Before we begin, though, I do want to make a quick distinction between pet therapy teams, service dogs, and emotional support. Pet therapy teams are trained teams to give support to other people. Many dogs are have an affinity, okay, is what we call it, right? An affinity. They're very empathetic and they like people. And so these are dogs who like to visit with other people. So if you have a very outgoing dog, this is one of the qualities that we look for in a therapy dog. And all of you have very outgoing dog here, and outgoing dogs here. Um, Kamara is sometimes a little shy, but she still is always wants to be in the attention and in the know. And I've got Phantom over here. Phantom's like, I'm just going to take a nap because we're talking back here. And so what pet therapy teams do is they visit hospitals, schools, they participate in crisis situations. They also work in courts and many different situations. And we'll hear about how some of these dogs work in the community here. And then service dogs are specific task trained for a disability. And so those dogs only work for one person. And but we're going to meet Mr. Banks here today, who works in a dual role. So he started as a service dog and now works as a service dog and as a therapy dog. And so we'll learn a little bit more about that and how that works and how he crossed over into both of those jobs. And then an emotional support animal, or an ESA, is a pet that you have at home that provides you comfort but isn't specifically task trained for a disability. So they will, and sometimes they are working a little bit in that alerting or giving you comfort, but they're not prescribed by a doctor, and they are they're like, you didn't take them to specific training. Like, they're not trained to alert to a panic attack or something like that, but they do provide comfort. The one distinction about an ESA is that you can get them prescribed by a mental health professional, and you can have them with you in housing that does not allow pets. And so that is something that a mental health provider has to provide a written prescription for, to provide to housing. And so that is where that distinction comes from. If you already own your home and you don't need any housing access, then you don't need anything special, because ESAs, emotional support animals, do not have any public rights, which means you're not allowed to take them out into public, into grocery stores, or with you into hospitals or anything like that. So they don't have the same access that service dogs do, because service dogs go through a minimum of 120 hours of training before they're even at the point of task training or taking a public access test. And so, which is very similar to the same hours of training that most pet therapy dogs go through. And while there isn't necessarily a set standard of training for pet therapy or service dogs in the United States, Assistance Dogs International standard for service dog training is a minimum of 120 hours, and the dogs have to be at least 1 year of age before the public access test. And all of the dogs here have gone through Pet Partners, and Pet Partners standard is the dogs have to be 1 year of age and have to have some basic standard skills and pass an evaluation, which is very similar to those same standards. And so that's why I said it's kind of a similar thing because of the different standards that these organizations follow, that therapy dogs and service dogs go through an extensive amount of training that ESAs do not. And so that is a difference about being in public. However, therapy dogs do not have the same access rights as service dogs. So you cannot take your therapy dog into the grocery store, right? Or you don't necessarily have the same ability to fly with a therapy dog as you do with a service dog, unless it's in the scope of your job. Okay, if you're being called to work somewhere, like for a natural disaster or something, that's different. However, your dogs can fly on a plane, you just have to pay for a ticket. Service dogs get a ticket. And so that's kind of, I think, where that misconception is. And so dogs can fly on planes, you just have to pay for them to fly on a plane, all right? So it's not that only service dogs can fly on a plane, it's just that they get a ticket, all right? Now, then, so that's clear as mud, right? Everybody understands that. So now I'm going to throw in another term that's really going to throw everybody for a loop, because there's another term that's called an assistance animal. So internationally, the term assistance animal is used to describe a service dog. And so in pet therapy here in the United States, we call therapy animals assistance animals. We call it animal assisted interventions. And so this is where the language gets really confusing, because when you say animal assisted intervention is pet therapy, and internationally the term for assistance animal is service dog, I feel that this is where everything gets very blurry, and then this is where people don't know which terminology to use. And so internationally, an assistance animal is a service dog or a guide dog, because internationally, service dogs and guide dogs are two separate categories that fall underneath assistance dogs. And pet therapies, it's a totally separate category that doesn't fall under assistance dogs, but they're all working dogs. Okay, so this is where this gets a little confusing, right? And so, but if you, and also then when we have people coming in from other countries that are interchangeably using those terms, it's easy to see why when you see a dog in a vest, what does everybody automatically assume when you see a dog in a vest? Service dog, because we've been now told, right? We've been told, and we've told our children to, when you see a dog in a vest, what do? Don't pet, don't touch, right? And so what does your vest say?
Rosie's vest says therapy dog.
Oh, here's the microphone. What's hers say?
Rosie's vest, she wears she wears two bandanas commonly, and her one that she's wearing in the back says therapy dog, and her one that she's wearing in the front says therapy dog, please pet. She would love to have a pet.
She would love to have a pet.
So hers says pet me, okay? And then let's confuse everyone further. What does your vest say?
Mr. Banks's vest says service dog, do not pet.
Okay.
And I need to get him an additional vest that he would never wear at the same time. But this particular one, today he's been my service dog through my work, and so it is an instruction for people not to just approach him and start petting.
Okay. And so one thing I've seen in dogs that dual work is a sticker or a patch that says, please ask to pet. Too is another thing. So then if he is working, you can always say, not right now, we're working, is something we can say too. And then what does Kamara have over there?
Well, Kamara's has one that's from Pet Partners that says therapy dog Kamara.
All right, and then Phantom is naked. Is that she's naked? She's naked today, so she doesn't have anything on at this time. for that. And so what we're going to do next is I'm going to introduce everyone that's up here on this panel. And then we are going to learn a little bit more about these pet therapy teams that we have here and the work that they do. And we're going to clear up a little bit more of that muddy terminology and learn more about the pet therapy. Maybe it's me, maybe I'm messing up the microphone here. No, you don't think it's me?
No.
Okay, well, maybe it's not me. All right, so today what we want to talk about is pet therapy. And so pet therapy is all volunteer based. So everyone that you see on this stage today is here on a volunteer basis, including myself. And so I have been a volunteer with Pet Partners for a very long time. I don't even know the number of years now. I've stopped, I know. I don't know why Rosie's huffing about that. And so I've been with Pet Partners. I started in pet therapy with my my therapy dog Legend, who was my golden retriever, and I started as a pet therapy team, and so we volunteered and we did a lot of children's programs because that's what he wanted to do, and that's what we did. And then I volunteered for enough years, and I volunteered and assisted in therapy evaluations and in instruction courses and with my mentor, and then I became an evaluator with Pet Partners. And then you have to be an evaluator with Pet Partners for enough years before you can become an instructor. And then I became an instructor, and then I became a volunteer community leader. And so I have two pet partner communities that I do something with. No, that I put information out for continued education and for groups, and we just put out some more dates for the QPR classes, and so I'm going to have you talk a little bit about that because you participated in those. So we have some more dates for those out for some continued education and in what we do. And then now I just took some additional courses through Pet Partners to do facility dogs. So those are going to be dogs that work full-time at facilities. And so that's going to be the next step in pet therapy, on my journey in pet therapy. And so we are going to talk about, oh goodness, this keeps resetting. So we're gonna talk about how we edit is how we're gonna do that when we put this together. All right, and so what we're gonna talk about today is how this volunteer-led practice builds community connection and how we help people feel seen and supported in vulnerable moments. And our guest today will share how they got started in this work, what keeps them going in this work, all right? And what this work means to them and to those that they serve. And so we're gonna go ahead and get started with introductions. So I wanna know who are you?
Yeah.
Who are you? Okay, and who is your therapy teammate? And so we're gonna go ahead and start here on the end.
Hi, I'm Barbara, and this is my therapy team. This is Kamara. Kamara, can you get up here? Come here. Oh, maybe not.
No,
Just
right
not.
now.
Kamara is a 9-year-old English setter. And Kamara and I got started in that, well, we have her son, who is a little pink bun to have a 1-year-old English setter. And we got her because she was the mother, and we've had her mother and her sister before. And when we took her to the vet, initially to be checked up right after we got her, the vet said, you know, she'd make a good therapy dog because I can touch her all over and I'm in her face and she's not licking me. And I'm a retired RN and I'm a snowbird, and so I haven't kept my license up in either Arizona or in Washington State just because I'm bouncing back and forth and who wants to hire me for 6 months and that. And I don't really feel the need to work, but I felt the need to do something. And so the thought of her being a therapy dog and us being a team was really attractive to me. And so that's how we got started. We've been certified since June. We did pass our first time here with Kristi. Kamara is 9 years old, and Kamara is from a show dog history. And show dogs are not trained to sit, or really any obedience training, because if they sit in the ring, the rumor is that they'll lose points. And I could get Kamara to sit, but I couldn't get her to lie down. And that's a critical issue that needs to be passed. And she'll always look at me like, I'm fine standing. Not swearing. I'm good. And it was really frustrating for me, and I talked to Kristi about this. I really had to stop and think, who am I doing this for? Am I doing it because I want us to be a therapy team, or does Kamara really want to be a therapy team? And we were lucked out in that, as I said, with Snowbird, we went back to Washington State in May. In June, we got tested out, and we really lucked out there in that we were on the wait list. And so we're an hour away from the training, and I said, well, should I bring the dog or not in case someone cancels? And the lady said, well, why don't you just come and be the neutral dog? So we did, and then someone did cancel. We got scheduled for 10:30, but we were supposed to be there at 7:30. So we went through the training, went through the training of the volunteers and the thing, and the lady said, you passed. Well, that was well before 10:30. So we did it just when my anxiety was down and Kamara's anxiety was down, and that was really nice. So since then, we've been going to hospital up north, and then just recently we've been going down here, surprise. And the benefit of it is that, I've heard this before through Kristi's training, is how excited the dog is when they know you're leaving. Because I have certain things that I take all the time, and you don't want your dog off the leash, but this dog I could have off the leash because she's gonna run right to the car and wait at that door until I open it up. And she loves going. When she gets that vest on, she is just all wiggles and wanting to go. And the staff love her, and she loves them. And what I find is that it's really almost the staff like the dog therapy more than the patients. The patients will last if they have the dog come in. But really the staff love that break in their day and helps bring their blood pressure down a little bit. And it helps me. So that's what we've been enjoying.
Right, so just introduce yourself.
Oh, sorry, introduce yourself and who your teammate is here today. My name is Pam Reynolds, and my teammate here, who's now laying down, is Mr. Banks.
And, well, it's not, yeah, no, it isn't you. Sometimes if you hold it on that pad, so you can.
And here we go.
Touch the antenna. Cool, okay.
Oh, here, it's where my hand is.
Yes.
You have discovered the secret.
Okay.
Alrighty then, you're gonna edit that part out.
Okay, I am.
Yes. So Mr. Banks and I, now I didn't move, here we go. Mr. Banks and I came together as a team and a partner service dog initially, but what we're talking about here today is the pet therapy dog. So through my relationship with Mr. Banks, and meaning that he goes with me everywhere to work, to grocery stores, to out and about in the community, and my work calls me to attend to people in the hospitals and sometimes in their homes when they are ill and on hospice. I go to rehab centers with him, and all of that started that he was my companion as a service dog. What I noticed was that during all of those visits, that he has a compassion and, as Kristi said earlier, an affinity for identifying the person in the room that is needing comfort. And one of the profound ways that I discovered that was I was meeting with a family who had just lost a loved one, and we were planning a funeral service for that person. And one person in the group was particularly distraught that day. And Mr. Banks was in my office with us all, and he went underneath the table and laid his body across this woman's feet. And so I spoke with Kristi about, there's something a little extra going on here. And so we talked about, well, there's a possibility he could also serve as wonderfully as a pet therapy dog for people who are just looking for a comfort, to bring a smile, to bring some relaxation, and to just help them feel better when they're down low or need a little extra companionship. And so that's how he and I also have now went through training with Kristi, and we were evaluated, and we passed the pet therapy evaluation. And so he is now also a registered pet therapy dog.
All right, and so my name is Kristi May, because I realized I didn't introduce myself when we got up here either. And Legend was my dog, and I ended up with Legend, a golden retriever puppy, 2 weeks after I got home from deployment in Iraq. And I had no intentions of getting a puppy. I didn't even have my household goods delivered and unpacked yet. And I had come back and started school. There was an incentive when we were deployed in Iraq that if you re-enlisted while you were deployed, when you came back home, instead of 2 months leave, you got an additional 6 months leave if you went to school full time, and the Army would pay for your school. And at the time, I had exhausted all of the correspondence and online courses, because online wasn't the same as online is now. And in the vet tech program at Murray State, and I needed to take my labs. And so 2 weeks back from deployment, I was sitting in a classroom at Murray State, and this little fluff ball puppy runs in by himself, nobody else around. And he came in and ran right up to me, and I started petting him, and I said, "Where did you come from?" And eventually a head peeked into the room and said, "Oh, there you are." And I said, "Oh, is this your puppy?" And she said, "No." And I said, "Okay." And then she said, "Well, I found him this morning on my way out the door to class, because it's the first day of class." And she said, "I checked all around my neighborhood, and I mean, it's a tiny little puppy, like we're only talking a few weeks old." And she said, "I couldn't find where this puppy belonged. I took it to the vet, no microchip. They gave him his first shots and dewormed him, but I can't take him home. I have a reactive dog at home, and we also have a dog limit in the apartment that I'm renting." And she said, "So I need to find him a home by 4 o'clock. And I said, "Well, I'm going to be in this room at 4 o'clock today if you don't find him a home." And so at 4 o'clock, he came running back into that room, and so I put him underneath my arm and walked out the door with him. And we had to go to PetSmart and with him underneath my arm, because I had nothing for a puppy. And I took him to school with me every day. And then when I went back to work at Fort Campbell, I was in a building that was dog friendly, and everyone else was bringing their dogs to work, so I brought my dog to work. And then I continued on with my bachelor's and my master's at Murray State, and I was in the vet tech program where you bring your dog to school with you every day. So he went to work and school with me, and the same thing happened. I watched him go to whoever needed him that day. There were days that I couldn't get him away from whoever he was near. And people started coming to my office at Fort Campbell just to sit on the floor with him. They would come in, and they would be very upset if they came in and he wasn't there. They would be like, "Oh, we came in for Legend." And I was like, "Well, he's at the groomer." And they're like, "Well, what time will he be back?" Like, they were upset. And I was like, "Well, I'm gonna have to start like an appointment chart for him," because people were coming to find him and just to sit and be with him. And so I just watched him. I watched him do that. And so he is, and so then I had to learn how to basically do what he was doing. And he did that in my classroom with my students. He did that at work. And like I said, people looked for him. They were always looking for where he was. And that's kind of how we got started in pet therapy. Is he was already doing the work. So then I had to catch up, is what happened.
I'm Amy, my pet therapy dog in crime, who's sleeping, I believe, is Phantom. Phantom is a 6.5-year-old rescue dog.
that I got just as COVID was starting back in 2020. And the one thing that I noticed that was different from her compared to my other 3 shepherds is that she's just a very chill dog. And anytime we would be out somewhere, she would seek out seeing other people, wanting to see other people. And then about a year ago, I happened to see online on Facebook a meet and greet for pet therapy. So I decided to come and just get it checked out, and then a couple months later, Phantom and I started some more advanced classes with Kristi, and then we graduated in September, and then, well, we graduated the classes before that, but we certified back in September and passed. And since then, we've been doing 1 day a week down at Banner University Medical Center, visiting patients and staff. And the other day a week, we go to Erie Goldwater High School for the kids' reading programs, which you'll hear Rosie here does as well. And they have found already that the kids that read to both Rosie and Phantom have already surpassed end of year goals for reading. One of the students that reads to Phantom had a very bad problem with stuttering. He no longer does that just by reading to Phantom. And I don't know, I find that she just loves going both places. When we get to the hospital, her tail's wagging as soon as we get out of the car. She'll come off a little bit hot on the elevator. Because I think she's ready to go in. But it's like, and I think she shocks a lot of the people, as we get off the elevator to go across. And I'm just like, chill out. But it's like, as soon as we get in, she just falls right into place. She's like, come on, Mom, hurry up, we gotta go.
We got people to see.
We got people to see and places to go. But she loves going to the school too. So both places she just loves. And I know at work, because now we just generally, yes, I know. At the hospital, we just right now see like the general patient population. But I noticed the last time we went on Friday that it seemed, I mean, staff always has needed it, and like a former friend up here, I am also a retired nurse, so actually Banner University is where I used to work. But we found that last visit that it seemed more of doctors were needing the pet therapy because of stuff that was going on with patients and having a bad time. So it was just beyond nursing. It was more of the doctors, which is kind of like a big change. But I know one of the cancer doctors has stopped us on several occasions to see if we could come over there to their cancer treatment center. So we're gonna kind of put that in the works too, because right now we're just doing 2 days a week. So eventually it may bump to 3 days a week. So 1 day would be just general patient population, and the other day would be the cancer treatment center.
Well, my name is Liz Jenkins, and this is my partner, Rosie. Rosie's a 2-year-old golden retriever, and when she came home to me at 8 weeks old, we had a friend who, retired Marine, who was on home hospice, and Rosie visited him every day of her life for the first 7 months of her life. I like to think that informed her career choice later on. And she started training with Kristi with Legend Acres. working on the Canine Good Citizen and the Canine Good Citizen Advanced Canine Urban. And we were in our last day of our Canine Urban class, and I was sad because I thought, this worked.
Just keep up.
Training.
Don't turn it off and turn it back on, and we'll edit that out.
The training that she had been doing was so uplifting for her, and it was just really what she craved. And so I really was concerned, well, we are at the end of this traditional obedience training, so what is next for her? And so I asked Kristi, she was seated right by Kristi's side, looking up at her adoringly, like she does when she's on a therapy visit. And I said to Kristi, what do you think is next for Rosie? And I thought she was going to say agility or scent work. And she looked at me like maybe I was a little slow. And she said, obviously, therapy dog. I said, oh, now I see it. And so we started doing the specialized training to prepare her to be a therapy dog. And Rosie was not yet 2 years old. At that point in time, she wasn't even 1.5 years old. And so my perception was that she really needed we really needed a lot of training. And so because I had the misconception that we needed to be perfect before we were to be evaluated and before we could start making a contribution in the community. But Kristi helped us understand that you don't have to be perfect. You just have to want to do it. And so we are so overjoyed that we did pass our evaluation last June, and we have been volunteering in the community since July. So at this point in time, on Thursday this week, we will have been a registered Pet Partners teams for 6 months. And during that 6 months time frame, by Thursday, we will have completed 65 official visits. Rosie is young and she has a lot of stamina, and I am fortunate to be retired. And so we can make a greater commitment in our community than many people. And so we are blessed right now to be volunteering on a regular basis 3 times a week. And then we have some ad hoc assignments as well. So one of our regular places that we volunteer is at City of Hope. It's a cancer treatment center. And when we're there, we visit with people that are having infusions, and we visit with people that are, with families that are waiting for their loved one to have surgery. And so also people that are waiting for their radiation appointment or waiting for their family to come out of their radiation appointment. And we also do visits with people who are getting inpatient treatment. And like some of the other folks have said that visit at hospitals, we find it to be true also that the staff needs Rosie just as much as the patients do. Rosie right now really needs Amy. Can you sit? Thank you so much. And then we also do volunteer at Barry Goldwater High School, where Rosie is a reading dog. She, as you can see, is still exuberant. She's 2 years old. And so she isn't a perfect reading dog because she sometimes has a hard time sitting still. Is that okay? It is okay. She makes up for it in so many other ways. And so when we get done listening to our students read, we go out in the common area where folks are having lunch, and she hugs on everybody she can find.
What do you have in there?
With a sandwich.
Yeah, what do you got in there? That is apparently,
Can you sit, please? Yes.
It's a little filet mignon.
No, I would have pulled that out.
And last but not least, our third regular visit of the week is to Hospice of the West. We volunteer at 2 different assisted living facilities where they have beds for hospice patients. And so Rosie makes an impact there, and we are really blessed to really be able to provide moments of calm and comfort and unconditional love. People feel it, and they remember their own pets, and they love to pet her because her fur is soft, she's warm, she presses up against them if she can. If they're in a chair, she can press up against them. If they're in bed, she just gets as close as she can to them. And we also volunteer at a couple of other places. We volunteer at a middle school that's a charter school, and she's there for stress relief on testing days. That's just on an ad hoc basis. We listen to kids read at our local library on an ad hoc basis once a month, and then we do special events. One of the things that Kristi mentioned at the beginning of the program was QPR training. So that's training in being able to have meaningful conversations with people that are really struggling in mental health area, specifically in that they may have some suicidal ideation. And so we had the opportunity to use our training in an informal setting. We were actually at a party that was being held in Rosie's honor because we had passed our evaluation, and a young lady mentioned to us that she was self-harming. And because I had had the QPR training, I didn't look away like I might have done before the training. And so I was able to have a conversation with her where I reiterated that Rosie wanted her to be here, and that was very important. And so Rosie was helpful to her, and she spent a long time hugging her that day.
Thank you so much for sharing that. And so I only asked them one question to introduce themselves and their dogs, and then they answered the next 5 interview questions. So we're just going to skip down to the rest of the interview questions.
We're overachievers.
They're all overachievers, which is why they're all up here on this stage and here as well. And so the next question that I do want to ask then is, was there a moment during a visit that really made you pause or feel something shift? And then what's something that people often misunderstand about therapy teams? Or what about this work, what is it really like that something like you didn't expect about this work, but you had an idea of what it was going to be, but now that you do it, that you have a better understanding of it. So those are the questions that I would like you to answer now. So we're gonna come back over here and start on the end. Repeat the first one?
Absolutely. And so, was there a moment during a visit that really made you pause or feel something shift, like something that your dog was able to do for someone?
For me, it was really how calm the dog is and how the staff, visitors, and the patients really, really needed that. Just at our last visit, we were actually signing out for the day, and this young girl came up to us, and we had indicated that her father was in the intensive care unit on a ventilator, 49 years old, been in the hospital for weeks, in and out of an induced colonoscopy on the ventilator. And it was like she just could not stop talking, and she couldn't stop beating Kamara, and it was like she really needed an opportunity to vent. And we're trained, obviously, just to sort of listen. Particularly, it's a little hard for those of us who are former nurses not to also get advice too, but knowing that that's not our role, that we're there for a different role. But you could just really see her whole demeanor change. I'm retired. I didn't feel the need to get out of there at all, which was good. I didn't have any other appointments to make, but you could really see how beneficial it was for her that she recognized Kamara, particularly that she had the vest on. She was in the hospital for that. So give me the other questions, because I answered that before. So
That's no excuse.
Okay. And then what,
Dog, cat.
what's something that people often misunderstand about therapy teams, or what is this work really like?
Again, back to your first time, when you're talking about the difference between the service dog and emotional support dog. Again, another nurse came up to me and was noticing that she was a therapy dog, but then started talking about her son with autism, and that she really hoped to get him a therapy dog. And I said, well, really, it sounds like you need a service dog. And clarity, but the service dog is specifically for a particular person, not for a group of people. And then a lot of people also think that a therapy dog can just go into any situation in any area. So, and I try to explain that, no, I need to be invited into an organization like this. I can't just bring my dog. So I can't take my dog into the grocery store. And having her have the best on is help clarify that. And the last one.
That was it, just if you, or like, did you have any like ideas about what pet therapy was going to be before you got into pet therapy that then you realized were different? Like, as in, the general public has this perception of what pet therapy is, and then the reality of what you really do in pet therapy. You're getting bored.
I think a lot of what Amy said is that what I noticed particularly as we're in the hospital settings we've been in so far is how much the staff really like it. And I find that even I'll go into the emergency room with her, and the doctors actually want to get down on the floor and pet her. And when we walk away, they say, thank you, I really needed that. That was really helpful. At first I was thought, well, I'd be intruding on these people's work, interrupting their work. And, Josh taught you shouldn't be interrupted, you should do something important. People really want it. And again, would be sought out by a head of the pharmacy saying, I really need you to come down and bring the dog into the pharmacy. Or I really need you to bring my dog into the lab. So those are areas that aren't typically seen.
Thank you.
Again,
Oh, you need the question.
yeah, being on the downside of
Okay,
30.
okay, all right.
I'm sorry.
So, so the question was,
Yes.
is that, was there a moment during a visit that really made you pause or feel something shift?
Yeah, definitely. We've had a couple of those. And I think probably one of the most profound has been during a couple of home visits that I've had with some of our folks that are in hospice, and truly toward end stage. They're about at the transitioning time of becoming non-communicative and yet not quite there. And twice now I have had these very fragile, frail folks ask if Mr. Banks could join them in their hospital bed. Mr. Banks is a petite young man at 97 pounds. Sometimes he weighs more than the folks we are there visiting. And I have said, yes, I'm just concerned, as hefty as he is, I don't want him to hurt you. I don't care, please invite him to come up. On both of those occasions, I have seen him do amazing, intentional stepping from the ground and gently come up onto this bed, beyond oxygen tubes, beyond IV lines, beyond all of those things, and then gently find a place where he can settle in and then receive petting and give back. And that has absolutely stunned me, that he's that agile and aware that he needs to be careful about where he plants his big body. And he has brought complete joy to these people who are transitioning away. Another thing is that some of our hospital visits, he has taken me to a room where we were not scheduled to visit. And he has stopped at the door, and on two or three of those occasions, sometimes it's been strangers. On one occasion, it was another parishioner of mine that I didn't even know was in the hospital. And he stopped right there at the door and said, no, we need to wait here. So I've learned to pay very close attention to his cues, because he hasn't been wrong yet. And in the other cases, it has been someone who has absolutely been overjoyed to see a dog, a friendly dog, come into their space. Again, having lost one of their own or just needing to be cheered up, hospital staff is the same way. So those have been shifts for me in the awareness of his awareness about knowing where he should be, which has really been amazing. Question 2.
What's something that people often misunderstand about therapy teams, or a misconception that you had about pet therapy now that you do the work?
Well, I've learned a whole bunch about, I really myself didn't realize the difference between service dog and therapy dog. And so now Kristi has helped me with redefinition of the clear delineations between those two. Most of the time, people assume immediately, and I just see on their face that they're almost vibrating with expectation, wanting to touch this fluff ball. And they say, oh, I know I can't. I said, well, yes, you can. He's a therapy dog, which invites touch. It invites relationship. It invites proximity close to one another. So most of my situations have been people that have been very conscious of wanting to respect, but assuming that I have a service dog and not a therapy dog. And that may lend to them not knowing the real difference between service dog and therapy dog. But when I tell them, oh, please, go right ahead, they are just, over the moon to go ahead and engage with them. Yeah. Was that it? Am I done? Okay.
Well, and I think too that having a dog in a dual role as a service dog and a therapy dog, and since he's marked service dog, we talked about that in the beginning, it's kind of one of those things that people just assume that they're not supposed to pet. And so then when you're crossing that line, then they're like, oh, and then they like, but he's so fluffy, and then they're excited when they do get to pet. It's one of the things that I learned from what I learned from watching The Legend. It was that he would park himself. He would walk a room and park himself in front of whoever needed him, and I couldn't get him to move if I wanted to until he was done there. But then when he was done, that was it. He was done. He was done. And sometimes he'd get up and leave the room, and I'm like, oh, I guess we're done here. And he would just leave the room, and I'd have to follow him out because when he was done in that space. And so it was the listening to him. He knew what would be needed. And he could walk through a room of kids all sitting on the floor, and he would sit in front of that one that needed it. And that was something really, really amazing to watch, to do that. And I guess I didn't know, I guess I had an idea of what pet therapy was, but I really didn't have expectations or really know what to expect with pet therapy, especially in kids programs. And then, like you're saying, with the teachers and the and things, because I started to see more of that, like coming to work, and that it wasn't like in the idea of like who the target people that we want to serve in pet therapy, who that ideal person is that we set out to to serve, and we are missing all these other people over here, and that but our dogs aren't.
Yeah.
And that they're being drawn into that, and that's why the facility dogs are becoming very popular. And so just an example of that, and so a facility dog is a dog that is usually a practitioner's dog. So at a mental health facility, that dog's there all day. And then I have several dogs that are at schools here in Surprise that are at school all day because they are there with the teachers and with the principals. And so those dogs are outside of the scope of a dog who goes into some place and is only there for a couple of hours and leaves. Well, and the workload on those dogs is different. And so And so Pet Partners has also recognized that, and now there's different training courses for those dogs and different evaluations for those dogs. And so they're not coming through the same way anymore because their job is very different in that way. But they're not just working in the capacity for the patients or the children, but also everyone that's there.
You just reminded me, Banks has taken on that role. We have a staff of 9 where I am, and he is with me every day by virtue of the fact that he's a service dog, but he has also become beloved by the staff. And if I come by, for whatever reason, if I show up here, on a day and I don't have him with me, it's all of a sudden, the first question is, where's Mr. Banks? Where is Mr. Banks? It's like, well, hello, it's good to see you too. I even did have a family that said, we're not really concerned that much about which pastor officiates at the funeral, but we want the one that has the dog. So I know what my place is here.
So, okay, exactly, so that is, so they do want you, not naming any names, but the one with the dog is the one that we want. Okay, so I'm gonna pass this over.
Well, and I think when I first thought about doing pet therapy, I'm not sure what I really thought. I thought I'd just be walking around with my dog, and that's what I'd be doing, and it's like totally different. I think too, the one thing that also going through all the classes is that it made me read her a lot better as well. Because there are times where it's like at the hospital, we have a 2-hour time frame that we're there. There are some days where at an hour and a half, she is absolutely done. She's mentally done. And I think before, I just would have assumed she would have needed to go outside, to go potty or something like that, versus just she's emotionally done. So I think it's really kind of helped me understand her and support her a lot better as well. But I know even like when we go to the hospital many times, we'll walk through and people will think she's a service dog and they'll ask, and then I'll explain to them, well, she's a pet therapy dog, we're here to visit patients and visitors. Is it okay to pet her? Oh, of course you can. Or, just out in general public, and speaking with somebody the other day, he was looking to get what he said, a pet therapy dog for a family member, when in essence, it was most likely a service dog that he needed and not a pet therapy dog. And at the hospital, we've had 2 separate instances of making people cry, but in a good way. The first one, we had actually, we were going around the surgical waiting room, just talking to people who are waiting for their loved ones to come out of surgery, and most of the people were just like, hey, how you doing, and petting her. And we encountered a table of family members, and the one girl, just after she visited with Phantom, just like started sobbing, and I'm like, uh-oh, did we do something wrong? And her mother explained to her that no, it's been a very emotional day for her, and Phantom just kind of evoked whatever ways for her to release what she was feeling. So it was a good thing. And then just in the last couple of weeks, we had been up on one of the floors and visiting. We will always check in with nursing staff first, just to make sure that nothing has changed with the patient before we go in the room, like contact precautions,
And one of the nurses came around the corner and she kind of stopped and she just absolutely started bawling. Turns out she had just recently lost her German Shepherd.
Oh.
And so Bantam was the first German Shepherd really that she has bumped into since she lost her own dog. So, you know, we just kind of sat there with her for a little bit. And I mean, we've seen her since and she is feeling a lot better, but I think it's just that first initial, you know, seeing a dog like the one that she had lost that was, you know, heart-wrenching. But it also made me want to tear up too because, well, we all been through that with our own dogs, so.
Well, we'll see how well I do at remembering the questions, but I may get them out of order, but I think I'm gonna hit them all. So like some of the other folks have said, as far as like the biggest misconception that I hear from people in the community is the issue about what type of dog Rosie is and a lack of understanding what a therapy dog is there for. I get a lot of questions about, well, what does she do for you? And I said, well, she's my beloved pet, but for when she's here for everyone. So that's kind of how I present it, that she's, you know, she's here for all of you. And that kind of leads me into my, I guess I'll call it my why, which, you know, what's been so meaningful to me is just the absolute joy that she brings. And we're in, you know, like a lot of other people have talked on, every other person on this stage has talked about, we're there at some difficult times. And she's making people laugh, and so they're just loving that interaction with her, which is so great. And we're starting to see people that recognize her in the hallways or in the waiting rooms at City of Hope, you know, or in the infusion area. Oh, Rosie's here, that's so great. I was telling my beloved family member about her. I hope they can meet her today. So that's been so meaningful. And then also, we do go to farmers markets on the weekends. So we started doing that when we were in pet therapy training. And so we did that as kind of like homework. But what's happened is that we've both just fallen in love with the markets. And so we had to continue to go every weekend, even though, you know, we're well past the training part of it. And also we've just been so bonded with all the vendors and the other people that regularly shop at the market. And so now it's not uncommon for a community member, most frequently a child, to recognize her and say, that's my dog. That's my dog from my school. And I said, yes, it is your dog. Are these your parents? Can Rosie meet them? You know, because of course they haven't had the opportunity. And then I'm gonna have to ask for help. Did I hit everything-ish?
You did.
Okay.
And at the farmers markets now, they're making Rosie her personal bling.
Yes, Rosie, all of her wear that she struts around in is crafted by vendors at the farmers market. So
It is.
it's given with love and worn with love.
Yeah.
Thank you. So I just have one last question, and so we're gonna keep it brief because we've gone over our time, and which is fine. And I know that we could probably sit here all day and talk about the work that you do. And so the last question I have is, what would you say to someone who is watching and thinks, I do not have the right dog, or I can never do the work that you do? So what is that one thing that you would say to them to encourage them with who they are now and where their dog is at? Or how to take that next step, or that they can do this, that anybody can do this?
Well, you never know until you try. So for me, Kamara was pointed out to me by a vet that she'd make a good therapy dog. But I have her son, who's 2.5 years old, And I keep thinking, I'm hoping that he can be one when she retires, but I'm not sure he is. But I'm thinking to myself, I will only know until I take him through the training, that I take him out and about and find out that. But I'm also amazed at that it's not just what we've talked about going around. There are also other therapy dogs that are out there that just do tricks. Yeah. These English setters do tricks. But some dogs, and the patients love that. So it's whatever skill or whatever your dog emotes, it can be done. And it's not just dogs too, it's ferrets and cats. And at one of the places I go up in the Seattle area, it's a pretty horse there. Love it, love it.
I have a very simple and quick answer. I say, Legend Acres, Kristi May, here's the phone number, and yes, you can.
Well, thank you so much for that. So, and I always recommend to schedule an assessment. Schedule an assessment, so get some eyes on, because like Liz said, she was like, oh, I don't know that I'm ready to do this, and you are harder on yourself and on your dogs about where you're at in your process and if you're ready or not, than anyone else is. And a lot of times you're the one holding you back.
Well, and I think with my 3 other shepherds, I guess I never thought about it with the first 2 of them. And I got both of them as puppies. With my shepherd before her, he was also a rescue, but he had been abused by somebody. I know he for sure was not a candidate at doing this. But then, I mean, I sat for years just thinking about doing this because I've seen her seek out other people and want to do it, and it's like, well, what's the worst that can happen? That she's just not a good fit. And like Pam said, Kristi May.
So to people that, it's just like everyone else on this stage has said, to people that think that they can't do it or are afraid to do it, you just have to put yourself out there. And it's sort of like, I knew that I was gonna evaluate even though I didn't think that we were ready, but you have to reach a point where you have to sort of like, well, I wanna make this left turn and I'm just gonna go for it. So.
I think we also have to remember that we're here as teens now, but at some point in time, we might not be a teen. But what can we do in the pet therapy arena that's as individuals, such as being trainers and evaluators or volunteers in the whole thing? We don't have to always be linked up as a team.
And so that's very true. And so right now, I don't have a dog with me on stage because I don't have a registered pet therapy dog at this time. And so my role right now is as an evaluator, instructor, and a community volunteer. And so that's very true. There's lots of other different roles in the pet therapy arena. So and those aren't always very relevant, or even not that they're not relevant. I mean, they're just not always visible exactly in understanding how to get involved, but there's lots of places. And a lot of you also started in volunteering before you had pet therapy dogs. You started volunteering in the pet therapy prep classes. You volunteered in the pet therapy evaluations. And then that also gave you an inside look into what the expectations were in an evaluation and of the dogs. And so that also helped you see where you were in the process. And I know that some of you came under there going, well, I could do that. And that was exactly my point of getting you in that room, right? Is because we're like, yeah, we could do that. That's not as hard as I thought it was, right? Because you had very different expectations of what that was going to look like than what the reality of what that evaluation really was. And so I want to thank you all for coming up here on this stage today and sharing your stories and sharing your teammates with us here because the work that you do is very important. And Rosie says she's done for it this time right now. But it's the impact that you make on the community and the people that you meet, because they don't forget you. That's why they're pointing you out at the farmer's market, and they're talking about you after they've met you. And so even though pet therapy is often mistaken for service dog work or emotional support animals, but they're definitely a distinct path. But pet therapy is built on community visits, the human-animal bond, and the connection and volunteer service. You don't need a perfect dog to do this. You don't even need a dog. We just said that. And you don't need a perfect story to come up here and to tell your story. And you just need a bond, a calling to serve, and a willingness to grow as a team. And if you're listening and this is something that you want to learn more about, or you're thinking, well, maybe I can do that after listening to their stories, then that's how most pet therapy teams begin, is listening to somebody else's story or seeing another pet therapy team in action. And so you're invited to explore, to ask, and to consider what the future may hold for you in pet therapy. And you can also consider what this would look like for you and your own pet therapy teammate. And that may not be a dog. That may be a horse, a cat, a bird. There's 9 different species that Pet Partners registers in pet therapy. So there's lots of different options out there. And this is how every great story starts. So thank you.